Hello and Namaste. Today I shall be discussing about parapharyngeal space abscess. This is defined as collection of pus in the parapharyngeal space, which is also called as lateral pharyngeal space because it lies lateral to pharynx. Therefore, parapharyngeal space lies on both sides of the pharynx. The etiology of parapharyngeal space abscess is as follows. Infection from the tonsils, that is acute tonsillitis or peritonsillar abscess, can spread to the lateral aspect of pharynx leading to parapharyngeal space abscess, which is the commonest cause. Infections from teeth, especially from the dental infections of lower last molar, can spread to the parapharyngeal space, which is one of the most important differential diagnoses of peritonsillar space abscess. In cases of complicated chronic otitis media, the infection can spread from the mastoid to the sternomastoid muscle sheath, which comes in the neck as Bezold's abscess. Bezold's abscess lies in the parapharyngeal space. Infections from parotid, retropharyngeal space or submandibular space can spread to the parapharyngeal space. There may be multiple space infections which will reach to parapharyngeal space, and sometimes penetrating injuries from the neck will also lead to infection of the parapharyngeal space, leading to parapharyngeal abscess formation. What are the clinical features? The patients usually present with fever, high-grade fever, sore throat, maybe tonsillitis, odynophagia, difficulty to swallow, and torticollis. As the pus lies in the parapharyngeal space, the patient will have deviation of the head towards the same side so that there will be less spasm and patient can handle more of the pus in the parapharyngeal space area. As we know, the parapharyngeal space is divided into two compartments, anterior compartment and the posterior compartment. The symptoms and signs may be different in two different compartments. On the anterior compartment, the tonsils will be pushed medially. If you look on the throat, there will be induration along the angle of the mandible on the outside. Patient may have trismus due to involvement of the medial pterygoid muscles, and on examination we can also see the external swelling behind the angle of the jaw, so in the anterior compartment. And patient may be toxic, ill-looking, dehydrated. In contrary to the anterior compartment, the posterior compartment is more important because it is also called as neurovascular compartment. Important neural structures and the vascular structures from the neck extend to the mediastinum through the posterior compartment. It is also called as Lincoln's Highway. The carotid sheath, which lies in the posterior compartment, is also called as Lincoln's Highway, that contains intrajugular vein, carotid artery, cervical sympathetic chain, and the 9th, 10th, and 11th cranial nerves. The child or the patient presents with neck swelling, and there will be bulge of the pharynx behind the posterior pillar. This should be understood. In case of anterior compartment, the tonsils will be pushed medially, whereas in posterior compartment, the pharynx itself will be bulged towards the medial aspect. So the tonsils as well as the posterior pharyngeal wall will be pushed medially in case of posterior compartment syndrome. But usually the anterior compartment, the tonsils will be pushed medially. As it contains the 9th, 10th, 11th cranial nerves, there will be paralysis of 9th, 10th, 11th, 12th cranial nerves and cervical sympathetic chain when the patient is having posterior compartment disease or abscess. This is very, very dangerous. Sometimes the pus may erode into the carotid artery or cause septic thrombophlebitis of the internal jugular vein, which is also called as Lemire syndrome. Therefore, we should be careful when the patient is having posterior compartment infection of the parapharyngeal space. This is the CT scan finding. This is the pharynx, this is the pus in the parapharyngeal space, and the posterior pharyngeal wall is bulged towards the anterior part as well as the medial part. You can see the tonsils are pushed medially and the lateral pharyngeal wall is pushed towards the medial aspect on the CT scan. Therefore, CT scan with contrast is the most important investigational choice in parapharyngeal space abscess to identify the disease location and extent and its extension to other compartments and involvement of the neurovascular structures. How to treat the condition? Treatment is by systemic antibiotics, ceftriaxone, amoxiclav, metronidazole. Both gram-positive, negative, and anaerobic coverage is to be made. When the pus is formed, then we need to drain the pus either by intraoral or by external approach. Intraoral approach is usually not performed, and its intraoral approach is usually not useful for large abscess. And most of the authors deny the intraoral approach because there may be bleeding from the great vessels. So this is usually abandoned, but when there is a small amount of pus, we can drain through the tonsillar fossa in the oral cavity. There will be no external scar. When the pus is in large amount, we can perform external incision and remove the pus from the neck. The approach may be transcervical through the neck, starting from the sternomastoid to the hyoid bone. As we know, the lower boundary or lower border of the parapharyngeal space is the hyoid bone. So we have to make an incision in the neck and we have to drain the pus. Transcervical plus transparotid. Sometimes the intercompartment contains the parotid abscess also, so we have to remove that. We have to go through the parotid and remove the abscess from the neck as well as from the deep to parotid gland. Transparotid alone, when the patient is having pus in the deep loop of parotid gland, that also occurs within the territory of parapharyngeal space, and sometimes infratemporal fossa for big abscesses. This is all about the parapharyngeal space abscess. Please subscribe my channel, Dr. Krishna Koirala. If you find this video useful to you, namaste and thank you.